you have to see that vitiligo as a life-altering condition and COVID as a life-threatening disease. This is a fight, and I have to, as a clinician, my problem is like balancing it out. What happens, like both are like related to immune system, whereas in vitiligo it is about autoimmunity, and whereas in COVID it is about like lower immunity towards this one virus that is creating the problem. So once suppose like patient is infected with COVID, the fight against body's fight against COVID and all those, that duration, the stress and all those things, that is changing patients' autoimmunity. So it is making their autoimmunity stronger, or the triggers like other triggers which are responsible for vitiligo, like their toxin levels or like cell death and all those things becoming more prior to the patient not affected by the COVID. This is one scenario where COVID infection per se making patients vitiligo aggravated. There are cases like I had seen, like the new ones vitiligo happening after COVID. So once this COVID vaccination started, we started seeing one more phenomenon. After 2 week vaccines and all those things, the patients their vitiligo is increasing. Because we cannot say that like patients should not be vaccinated because their vaccine is for fighting something life-threatening. So vitiligo can be managed later, even if it is increased. So the problem is like when you take the vaccine, there will be a change in the way body's immunity fight with the this one virus, or they fight with the our own cell, basically the autoimmunity. So we have seen that the autoimmunity part is increasing. In the process of making body's immune system against COVID virus stronger, patients' autoimmunity is increasing. So all of a sudden, their vitiligo patches are increasing, or what is happening, like even the patient, I'm seeing that their new onset means they were previously not having any vitiligo, they started having vitiligo. And one more thing happened, there are patients, they were coming as new patients. Their typical history like 10 years, no treatment, they're not taking any treatment, it was stable. All of a sudden, their vitiligo becomes aggravated. So in this situation, what happens that to deal with this kind of situation, I have to once again like modulate their immune system, autoimmune, I have to tackle the autoimmunity. Here I have to be very careful. COVID is not out of the picture because the third wave, fourth wave, or possible fourth wave is coming. So I cannot have a free hand in terms of fighting the vitiligo aggressively. So I have to still consider COVID as a risk. So I have to be a little bit conservative. So